Let's discuss the vaccine rollout for Correctional Services staff and inmates. And I'm joined now by retired Justice Edwin Cameron, Inspecting Judge for the Judicial Inspectorate for Correctional Services. Justice, thank you so much for your time this evening. Why is it important for inmates, and it's inmates of all ages, to be vaccinated ahead of, say, tellers in a supermarket? Why are they more important?
Well, Sally, I think you're asking a good question, and the question really touches on the fact that this feels counterintuitive to us. People are in prison for a reason, and they're paying a debt to society, so why should they step in the queue ahead of the rest of society? But they're very powerful reasons, Sally, and thank you for letting me come on to eNCA this evening to discuss this with you and with your viewers. Sally, first of all, there are ethical reasons which might not cut the dice much with many viewers, but we don't sentence people to death when we send them to jail. And in this epidemic, if it gets out of hand in our prison system, and our prison system is terribly overcrowded, it's about 25% overcrowded. We are cramming 30,000 too many people into our prisons than they were built for. If it gets out of hand, and I've been fearing this since the early months of last year, we will have a death and terrible sickness inflicted not only on the prisoners but also on the people that we require to look after them. So we sentence people by depriving them of their liberty, not by sentencing them to horrible illnesses and to punitive conditions in jail. But there are also very powerful reasons simply of public health, Sally. And here I would like to say that there's been so much wrong, so much lamentably wrong about our vaccination program since January, February, with the turning back of the Oxford AstraZeneca vaccine supply, which a few people even find comprehensible 5 months later. But this is one thing that government has got right, and all credit to Minister Lamola, who's a smart and savvy person. He's stuck by this. He put it into the national program that prisoners would come in the second wave after the over 60s, and rightly so. Sally, you know, we think that it's a comforting thought, lock them up and throw away the key. It doesn't work like that. Minister Lamola was saying today in the clip that you had on your show about an hour ago that people move in between prison. They go to hospital, they go to court. And of course, the warders, the personnel also do. So it's a very, very leaky wall when we put people behind that wall.
I think I'm not saying that, let's lock up, it's not an issue of that. It's more about why don't they, it seems almost they're getting a privilege because there are people with comorbidities who don't qualify, who can't get the vaccine because they're not the right age group. There's maybe a 30-year-old diabetic who today cannot get the vaccine, but a 20-year-old in prison can get the vaccine today. It seems too favourable in a way, I think, for some people.
I appreciate that, Sally, but we've got to take a step back. Prisoners aren't singled out. They are part of what the epidemiologists call congregate settings. So they like people in old age homes and very many other children's homes, people where people are bunged up together. And so they're not being made a particular special case. They're being treated like the science says they must be treated. We heard Deputy Chief Justice Moseneke saying earlier on your news show, Sally, that he's decided to follow the science. We are following the science here. When you've got people in congregate settings, whether old age pensioners in homes or children in homes or prisoners, you've got to vaccinate them before everyone else, at least after healthcare workers and 60-plussers. Then you get to the congregate settings, and that's where prisoners rightly are.
What if a prisoner refuses to get the jab? Are they forced?
Sally, I don't know the answer to that, but it just bewilders me. You know, Sally, I've been living on antiretrovirals for the last nearly 24 years. And at the time I started them, there were these dreadful people who later, unfortunately, got the ear for a while of President Mbeki. And this is the same thing, Sally. So I don't know what prison authorities will do. I haven't asked the National Commissioner, and until you asked me this evening, it didn't occur to me to ask him, because it just seems so dumb, plumb crazy, Sally. But there will be people, because of all this completely unscientific, mad dog vaccination skepticism, also I see promoted by public health, alleged public health figures like Professor Tim Noakes. It's crazy, Sally, and I hope that there won't be a single prisoner who will decline this very, very important, because every prisoner who refuses to be vaccinated puts the whole prison system at risk.
Yeah. I have to ask you about perhaps your most famous, prominent inmate at this time, and that, of course, is a man of nearly 80 years old who's in escort. Do you think that Jacob Zuma can really be kept safe from COVID while behind bars? Because his family was really concerned about that. Zwanele Manyes, we've just played a clip where he said it's really cold in escort. We're in the middle of winter. We're in the middle of a pandemic. And if I'm not mistaken, I don't think he's been vaccinated. Do you not have concern for someone like him?
Of course, Sally. I don't know the particular facts relating to former President Zuma. I hope he has been. He should have been vaccinated. I've had my first jab as a 60-plus. I hope he's had his first jab, and preferably his second jab. And the prison's vaccines are the single-dose J&J, which are supposed to be one-off. So I hope that if it's offered to him, he'll take it immediately. But I do believe that he's being very well cared for, Sally, for many different reasons, and not only because he's probably one of our inmates of most advanced years. So I'm satisfied as we talk here this evening that very adequate, careful, meticulous measures are being taken to safeguard him and to keep him in good care.
All right. Well, thank you so much for your time this evening. Much appreciated. That is retired Justice Edwin Cameron, Inspecting Judge for the Judicial Inspectorate for Correctional Services.